Hi, I'm Dr. Mario Vega, fertility specialist and scientific director at Panama Fertility. For many people, pregnancy happens easily. For others, it is incredibly difficult and may feel like a roller coaster of ups and downs. Although we may hear many stories about unplanned pregnancies, getting pregnant is a complex task and there are many things that have to happen, and if any of these things don't work properly, this process might not work. When infertility happens due to issues in the woman, this is called female infertility, and there are 6 main reasons that it may affect your ability to get pregnant. Problems with ovulation, blocked fallopian tubes, uterine abnormalities, endometriosis, and issues with egg quantity or quality. So let's review them in more detail. When you ovulate, your ovaries release an egg into the fallopian tubes. Hormones control this process, but if you're not ovulating, this release won't happen. If your periods are irregular, it can be an indication that you have ovulation problems. Although rare, you could have regular periods but do not ovulate. So the best way to know this is through ultrasound and hormone monitoring. Common cause of this is PCOS, or polycystic ovarian syndrome, but there are other causes of anovulation or lack of ovulation. For the egg to be fertilized by the sperm, they have to meet in the fallopian tubes. Once this happens, an embryo is formed, which travels to the uterus and implants there, becoming a baby. The fallopian tubes function like a tunnel, where the sperm and the egg travel, but if there's a blockage, the egg and sperm will not be able to meet. Some common causes of blockage of fallopian tubes are scar tissue from prior infections or prior surgeries. Some women actually may have silent infections in the fallopian tubes, meaning they don't become sick like you would if you had an infection elsewhere. However, it may still affect the fallopian tubes and create scars which may block them, and this may lead to infertility. In some cases, treatment with antibiotics may help, but if there's too much scar tissue, surgery or IVF may be necessary to achieve a pregnancy. Think of your uterus as a balloon that starts inflating once the embryo is implanted. It is a muscular organ that expands as the baby inside grows. But in many cases, the uterus has masses inside, such as fibroids, that are already expanding, and worse, do not allow the embryo to successfully implant. Most of the times, these fibroids are asymptomatic, meaning that you won't feel anything is wrong, but other times they can grow very large and you can have symptoms, such as a swollen belly, discomfort, or bleeding. In these cases, surgery is needed. Finding a specialized surgeon is extremely important, as removing fibroids without a skilled surgeon can lead to scar tissue and further infertility. Other uterine abnormalities, although less common, are congenital abnormalities. Some may lead to infertility and others are just curious cases, such as a bicornuate uterus, where your uterus is divided basically in two. In some women, it's a normal variant, and in others may need help of achieving a pregnancy. If you suffer from endometriosis, you are in the 10% of women in reproductive years that have this condition. For many women with endometriosis, it may not cause any issues and they may not be aware they have this condition, while in others, it can lead to chronic pain, infertility, abnormal bleeding, among other problems. There's a wide range of presentations for this, and some women may not be aware that they have endometriosis until they attempt pregnancy and have difficulty achieving it. The gold standard for diagnosis is surgery, although in most cases this is not needed, depending on the individual case. The treatment itself can consist in either surgery or reproductive assisted technologies such as IUI or IVF. The quality and quantity of your eggs decreases as you age, and starting in your mid-30s, this may be severe enough to cause fertility problems. Luckily, there are methods to preserve your eggs when they are still viable for pregnancy. But if you have been diagnosed with ovarian failure due to premature ovarian failure or due to age, there are ways to help achieve a pregnancy. If you have any viable eggs, this can be done through IVF with your own eggs. If not, though, there are always options such as donor eggs. Either way will bring you closer to your dream of having a family. I hope you enjoyed this video and learned a lot about female infertility. For more useful information, subscribe to our channel. If you need a consult, go to panamafertility.com and schedule a free consultation with us today.